Honey, let it go. Oh my God.
Secretary of Health and Human Services Robert F. Kennedy Jr. shared a video of himself wrangling 2 snakes with his bare hands.
What are they?
Well, if you thought America's top health official was spending his week focused on measles outbreaks, vaccine policy, or preparing for the next pandemic, even Ebola, nope. Think again. I'm Dr. Ida Brown.
And I'm Dr. Sonia Sloan.
And we are EYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So, a viral clip is making its rounds showing Health and Human Services Secretary Robert F. Kennedy Jr. casually grabbing snakes, not one, but 2, with his bare hands during what appears to be a wrangling demonstration. I mean, like, he thought that was pertinent enough to put on his social media. And so while the video seems totally harmless or even entertaining, it raises a bigger question, I think, really, about his leadership, the risk perception, and public health messaging, right? So let me be clear. This isn't about snakes, you guys. This is all about the optics, because at that moment, when the United States is experiencing the highest number of measles cases in decades, 3 decades to be exact, when health trust in health agency remains very fragile or non-existent, and when the debate over vaccines, infectious disease preparedness, and public health funding are dominating every headline, Americans are looking for their health leaders, not to handle snakes, but for confidence, clarity, and credibility. But instead, social media is filled with videos of the nation's top health official handling snakes, Dr. Brown.
So supporters will say this demonstrates Kennedy's lifelong interest in nature, environmental issues, and personal courage. Critics argue it highlights a recurring pattern, an attraction to spectacle that can distract from substantive health policy discussions. And that is really the issue, right? Leadership is not just about which policies you support, right? It's also about the message you're sending. Every appearance, every interview, every viral video that you post becomes part of a public narrative. And whether you agree with RFK Jr. or not, there's no question that he remains one of the most polarizing figures in American public health history. His supporters see an outsider challenging entrenched institutions. His critics see someone whose messaging has fueled confusion on critical health questions. What do you think, Dr. Sloan?
Well, I think, so when you're handling snakes, snake wrangling video becomes national news. And that has to be metaphysical for something. Snake man, I don't know. But it's worth asking, is this helping Americans focus on the real health challenges facing the country? I mean, are we making America's health better again? Or is there another example of political personality and spectacle overshadowing of the science and the public health? Because while everyone is talking about this freaking snakes, the real story is about what we're not talking about. Let's roll the clip.
So that's happening all over the world because, as I say, a global measles outbreak. At CDC, we encourage people to get their measles vaccination. That's the best way to prevent yourself from getting measles.
So this week, Health and Human Services Secretary RFK Jr. traveled to Virginia, and that state is dealing with a growing measles outbreak. Virginia has now reported more than 90 measles cases in 2026, with the largest cluster centered in Buckingham County. So state health officials say the increase is being driven by a combination of travel-related exposures and steadily declining vaccination rates. But what caught many people's attention was not just the outbreak. It was Kennedy's response. When asked about the situation, Kennedy acknowledged that measles is surging globally, and then made a statement that would have surprised many people who have followed his career closely, right? He said, quote, "At CDC, we encourage people to get their measles vaccine. That is the best way to prevent yourself from getting measles," end quote. I mean, that is remarkable. That is a remarkable statement coming from a man who spent years raising very public concerns about vaccines before becoming the nation's top health official. Dr. Sloan.
I can't with him today. So here are the numbers. Let's talk about science and be very clear. 2,030 cases that are confirmed measles in the United States as of June 4th, 2026. 92% of those cases are people who have been unvaccinated or whose vaccination status has worn out, according to the CDC. And 40 states, you guys, states and jurisdictions reporting cases in 2026. 6% of those are requiring hospitalization, and 127 patients have been hospitalized so far in 2026. It's approaching last year's full year total of 2,288 cases, and it's just June, which is the highest annual count the United States has recorded in 3 decades, you guys. So we're about to, surpass our own numbers at this point. And the majority of those cases, the majority, are children and teenagers. So measles is not a harmless childhood illness. Remember that. It is one of the most contagious viruses known in medicine. One infected person can spread the virus to 12 to 18 susceptible individuals. The virus can remain suspended in the air for up to 2 hours after its infected person has left the room. So before widespread vaccinations, measles infected millions of Americans every year and killed hundreds of children annually.
And the bigger concern is what this outbreak reveals about public trust. For years, America has been locked in a debate over vaccines, government agencies, and medical authority. But viruses do not care about politics. They do not care whether you are conservative, liberal, independent, or somewhere in between. Viruses exploit gaps in immunity. Full stop. And so when the nation's leading health official, a man whose career has been defined by skepticism of vaccines, stands in Virginia and says that vaccination is the best way to prevent measles, he's aligning himself with decades of scientific evidence, right? And with the position that's been held by every major pediatric and infectious disease organization in the world. But the question now is whether Americans would even hear that message. Because if vaccinations continue to decline, measles will not be the only disease that makes a comeback here, right? Public health experts are already warning about the potential resurgence of other vaccine preventable illnesses that many younger physicians have rarely, if ever, seen in practice. And that is not just a Virginia story. It is a story about science, trust, and whether we can separate public health decisions from political identity. And that may be one of the most important health questions facing America right now. Let's roll the next clip.
I'm going to go over some of the key numbers from the ADDM report. Overall, the autism is increasing in prevalence at an alarming rate.
And we have seen that. That is correct. But the Department of Health and Human Services says it wants a greater access to your health data. But officials insist that it's not about creating an autism registry, which is what they said several months ago, right? So what's happening right now? This week, reporting from the KFF Health News revealed that HHS has been actively pursuing access to state health information exchanges, large databases that allow hospitals, clinics, and healthcare systems to share patients' records electronically. And according to this report, Secretary Kennedy believes these records could help researchers investigate autism, chronic diseases, and vaccines safety. And millions of dollars in grant funding have already been directed to a Nebraska nonprofit that is assisting in this effort. And Kennedy argued that existing federal access to health information has been too limited. He thinks publicly stated that he was surprised of how broken the system was, and when he came into office, this was really bad, I guess. And he told KFF Health News directly, medical records are the key to finding the answers. But here's where the story becomes much larger than just autism. This debate is fundamentally about privacy. Medical records contain some of the most sensitive information Americans possess. As doctors, Dr. Brown and I, we know this. This is about the diagnosis a patient has, the medications they're on, their mental health history, reproductive history records, genetic testing, the physician's notes, their thoughts. It's the information shared in confidence inside of a room between a physician and a patient. Dr. Brown?
And, supporters of the effort say larger data sets could help identify patterns in chronic diseases, improve treatments, and uncover environmental or genetic risk factors that have been missed for decades. And listen, that argument does have merit, right? Research saves lives. But critics are asking different questions. Who oversees the data? Will the information be truly de-identified? Could records from multiple systems eventually be linked back to the individual patients? And perhaps most importantly, how do we maintain public trust when government agencies seek access to increasingly detailed personal information with no public announcement, no transparency, and no explanation of how that data will be protected? HHS spokesperson Emily Hillard did not answer questions from KFF Health News about how many states are participating, what new data is being collected, how much the federal government is spending, or who has access to the data. So the statement released simply said HHS is working to, quote, strengthen public health surveillance, end quote, as part of the Make America Healthy Again agenda. This is very dangerous, Dr. Sloan, wouldn't you say?
It's crazy. Yeah. As a physician, I think Americans should be asking two things. First, can large, well-structured data sets genuinely help us understand disease as it affects millions of families? The answer is, yeah, they can. But the second question is, will they, fully protect patient privacy, maintain their informed consent, and keeping the public trust? That answer depends entirely on how this whole process is going to go about, right? Because regardless of where you stand politically, once the medical information leaves the exam room and enters into what? Federal databases, transparency, accountability, and enforceability on privacy protections are not optional anymore. They should be essential. And now that's why the story matters even more and that we should really be paying attention, not just because families that are touched by autism, this is going to affect, but I think other things this could roll into, right? And anyone who's ever trusted a healthcare provider with their personal information is going to look sort of side-eye at us, right?
Yeah, I mean, as the Ebola outbreak continues to spread in Central Africa and public health officials work to prevent international transmission, a growing debate is emerging here at home. Not about the virus itself, but about who is leading America's response. Right? The World Health Organization declared the outbreak a public health emergency of international concern. And when reporters asked Secretary Kennedy whether he was concerned, his answer was brief. Yeah, we're working on it. That was weeks ago. So according to a sweeping investigation published this past Sunday in the New York Times, based on accounts from more than a dozen people with direct contact with Kennedy and current department employees, he has made no meaningful public comments about Ebola since. And so he has reportedly received very few briefings from CDC scientists, the few that are left, on the virus, and he has not visited the CDC since August. Dr. Sloan.
Since August, well, then let's talk about all the other things, right? Then there's all the empty chairs that are going on right now. So there's no confirmed Surgeon General right now. There's approximately half of the 27 institutes and centers of National Institute of Health are operating under acting directors. The acting chief of the National Institute for Allergy and Infectious Disease was recently fired. The FDA commissioner resigned a month ago. And then the CDC itself is now running on an acting basis. And he hasn't shown up since August? What? The Department of Health and Human Services oversees what? Agencies of approximately 340 million Americans. That includes the CDC, the NIH, the FDA, Medicare, and Medicaid. And collectively, those programs provide health care, coverage, or services for nearly 40% of the United States population. So according to the report that the New York Times had put out last week, the people running those agencies are doing so without confirmed leadership, amid a significant decline of morale and years of restructuring and staff departures. So the report describes a secretary who attends the department's weekly senior briefing roughly once a month. And when present, multiple attendees described him as disengaged, spending most of the meeting engaging the top national officials on his phone. Dr. Brown.
So, to be fair, supporters of Secretary Kennedy would argue that cabinet secretaries are not expected to personally manage every outbreak, right? Their role is to set priorities and delegate operation responsibilities to experts within the agencies such as the CDC and the NIH. They would also argue that Kennedy was brought into this role specifically to challenge traditional public health approaches and address issues he believes have been ignored for decades. But critics see something different. They argue that moments like an Ebola outbreak are precisely when visible leadership matters most. So public confidence during a health crisis depends on clear communication, frequent updates, and the visible reassurance that the nation's health infrastructure is functioning and that someone is at the helm. But Dr. Sloan.
Yeah, someone's at the helm. I don't know about that. That brings us to the question that most matters the most, I think. That it's not entirely about RFK Jr., right, as an individual. It's really about the preparedness, right? If another pandemic begins tomorrow, who's leading the response right now? Who's going to be communicating to the American public? Who's coordinating the federal agencies and state health departments and hospitals and international partners that we've disengaged from? And where would Americans know to look for trusted information? Those are the questions that matter, because public health emergencies do not just test our medical systems. They test our leadership, our communication, and the depth of public trust, Dr. Brown.
So, whether you support Kennedy's approach or oppose it, the debate has shifted. It is no longer simply about vaccine policy or health reform. It is about something much broader, whether the nation's public health apparatus is prepared, staffed, and led effectively enough to respond when the next crisis arrives. And as Black and brown women, as mothers, as daughters, as physicians, as community members, we know exactly who bears the weight when the apparatus fails. It is our communities every single time.
And that's why we're here. That's why we keep talking and being disruptive. So we want you guys to stay informed, stay, with accurate information, question it, but trust the science. We're AYA, contributors to MeidasTouch Network, and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Thanks, everyone, and go Knicks!
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.